Hey, y'all. Hi, Devin.
What's up? What's up?
Oh, very well. How are you, Dr. Lanier?
Good. How you doing?
I'm very well.
You rested from watching the Super Bowl?
You know what? I didn't even watch it. It was kind of like background noise. I was making my shea butter this weekend. And so as I was making my shea butter, I kind of peeked in and out. Then it was at zero for such a long time. And then I go to bed at 9 o'clock and I'm
Okay.
committed to it. So after I finished my shea butter, I did watch Bad Bunny, but I'm not an interpreter. So I don't know what he's saying. And
Okay.
I was like, I'm gonna catch these highlights tomorrow. So shout out to the Seattle, still not the Steelers,
Seahawks, girl. Them
the
Hawks.
Seahawks, the Seattle
Yeah.
Seahawks. Congratulations on winning Super Bowl 60.
Yeah.
I
Yeah.
think
Yeah.
that
Yeah.
means.
Yeah, for sure. I did my residency out in Seattle, so I have a soft spot in my heart for the Seahawks, and I got a lot of friends out there that are cheering for them. So I'm happy for them that they got this Super Bowl.
Yes, Charbonnet was on my fantasy football team, so he got hurt,
Yeah.
but he was definitely a very strategic part of getting them to the final game, even though he couldn't play and he was on the sideline. So that's my connection, Charbonnet. He's been on my fantasy football team for 2 years in a row, so I'm glad to see that he'll win, and I'm going to pick him up next year.
There you
Or
go. There you go.
I'm gonna pick up Kenneth Walker maybe because they
Yeah, he balled out. Super
yeah.
Bowl MVP. He balled out. They couldn't stop him.
Yeah, so he definitely is on my list for next year as far as like some players that I might choose on my fantasy. But we are going to get into happy Black History Month. We are in the month of February, and that is what the theme of our tonight's segment is going to be about. We're going to just get into like Black Feet Matter, and I love that we are two Black, you're a podiatrist, but we're in this industry, foot care industry, and we are representing very well. And to
Mhm.
be able to have a perspective that we have from this angle, I think is very helpful for the community. I know just spending time with you, I am definitely getting smarter. And you are smart, Dr. Lanier. Like, I didn't realize how, doctors really are smart, but you are. It feels like thing I throw at you, topics on topic, off topic, you always are quick and you just are just very like well-rounded. So I'm grateful to know a Black podiatrist, and you are just very like, you very highly educated, very articulate, and I'm just grateful to be able to share this platform with you.
Well, I really appreciate that. And, we all try and we try to know our craft well and just do the best we can. So, I appreciate, doing this platform with you as well. And I'm excited to get into Black Feet Matter, representing, our culture, especially during this month, and just putting some information out there to help everyone stay safe and to, just be thinking about their health.
Absolutely. So, without further ado, welcome back to another Teen Toes Down episode where culture, health, and real life meet from the ground up. And today's episode is special because we say, since it is Black History Month, we wanted to talk about the part of our health story that rarely gets highlighted but affects our community at alarming rates. So, and that is our feet. So, Dr. Lanier, when you hear people talk about health disparities, it's usually about heart disease, it's usually about blood pressure, but the feet tell a very real but a very quiet story. So, getting right into it, why are feet such an overlooked indicator of our overall health?
Yeah, so I just think because one, when we think about feet in our society, it's always kind of like taboo. It's always like ill, one of the probably most common things people say to me, whether I'm doing a telehealth visit or whether I'm in person, they're always like, "What made you get into feet? Do you have a foot fetish?" And all that kind of stuff. And I go kind of through my story and stuff. And one day we'll do that maybe on the IG live. But I think it's just something that people look at and they just don't want to look at. They're covered by socks, they're covered by shoes, and it's something a lot of times people forget until there's a problem until they start hurting. And so, we have to get out of that mentality that feet are nasty and we don't want to show our feet. We got to at least want to show them, to our doctors, to pedicurists, to people who, are in that industry that maybe can help us. And so, even I think, all of us, no matter what your color is, your feet a lot of times are neglected. But even more so, with African Americans, our feet are neglected just because, a lot of times when we complain about things or say things are going on, sometimes, we may not be listened to, or we may, be told to toughen up, or it's not really a big deal. And so, even things that don't hurt our feet, and we may have subtle changes, to our feet, maybe the color looks different. And let's say if we're going to, a doctor that is not our shade, and we say, hey, the coloration of our feet is off, maybe they don't see that. Maybe it's kind of like, well, your feet look brown, they look black, they look okay to me, and so you definitely have to get to that person that, will hear you out, will listen to you so that you can catch things early.
Absolutely. So, we like to start with the facts first. Black Americans are nearly twice as likely to undergo lower limb amputations compared to white Americans. Most of these amputations are linked to diabetes and vascular disease. But this is really what got me. Many of these amputations are preventable.
Yes.
So, from what you see clinically, why are these numbers so high? And how much of this is biology, or how much is it delayed care and access?
Yeah, so I mean, this is a huge topic. This is a big thing to talk about. Why do African Americans, Black people have, way more amputations than, our white counterparts? It's something that's distressing because even in my own practice, I can see that it seems like my Black patients, are further along the spectrum of disease than some of, my white patients when they come in. And you offer a great question. Is it just because is it nature? Is it just their biology? And we've kind of figured out that that's not it. We've had a history of, thinking in science that, your race has something to do with your biology, and that because you're Black, because you're Hispanic, because you're Asian, there's certain things that you're going to deal with. And for some things that's true, but a lot of times it's really socioeconomics and, kind of how you are in life and your place in life, if you're going to be able to get that care like you need, and being an advocate for yourself. Usually when I see people who, have some kind of, either whether it's diabetes or, blood flow problem, and they're Black, they're way further along. They come to me and, their toes are already turning black and they already have an infected ulcer. And before I can say, hey, let's do these preventative methods, I'm saying, you got to go to the emergency department and I'll meet you over there because we're going to have to go to surgery, really quick. So we have to figure out how we first have our, Black brothers and sisters coming in to get checked. Even if they don't have symptoms, they need to be checked some kind of way. Whether as you go to the office, whether you say, hey, something's been going on and it doesn't feel right, let me hop on a telehealth visit just so that I can talk to someone and see if this is something worthy of me going into the office for. So first we gotta be intentional. We gotta have that thought process to say, this doesn't look right. This doesn't feel right. I'm having a little bit of tingling. When I walk, my calf is starting to hurt a little bit more than it did. You gotta say, hey, I gotta go and speak with someone about this.
Yes, absolutely. So we're going from Black history, and so we're going to bring a historical play into. So during slavery, Black bodies were treated as tools and not humans. Pain was ignored, injuries were minimized, and medical care was delayed or denied altogether, especially when it came to feet, because it was critical.
Mm-hmm.
Enslaved people were valued for how long they could stand, walk, work, and endure. And that mindset has not disappeared. So, how do you see that legacy showing up in healthcare today?
Yeah, so when we talk to folks, I mean, they don't want to take off like work. I got to take off from work to get to the doctor. And, that's one of the things why I created this telehealth, is so that we could get to folks after hours. We can get to folks on the weekends. And, we can through telehealth, we may not be able to correct the whole spectrum, but we can get the visit started. We can get the conversation started and say, oh, this is what you have going on for sure. These are the resources you can use, and I can point you in the right direction. Because, we feel like we have to endure. We have to give everything. We have families that are counting on us. We have people that are counting on us. So our health has to take a back seat. And, I know a lot of people are like that no matter your color, but a lot of times it really does fall heavy on Black people just because a lot of times we're not in those like white collar jobs where, we can just take an hour off and, go to the doctor. And let's say the doctor's appointment went a little long. I'll just call in and say, I'm not coming in the rest of the day. We may not be in the position to do that. We may be in more of a blue collar job where, if we're taking off, we're off the clock now. We're missing that, hourly, paycheck that we're getting. And so we really have to get in that mindset to try to figure out how do we not have this mentality that I got to keep pushing, and I got to slow down, and I got to think about things and really take care of myself.
That's good, Dr. Lanier, for sure. Is there a connection between slavery era medicine and how pain is dismissed now?
Certainly, and there's been many studies that talk about, the pain that people, especially Black people, come in and talk about, and a lot of times it's dismissed. And there's an inherent bias in, healthcare. And it's not that doctors or nurses or PAs or anybody who's a healthcare provider is racist in any kind of way. It's not that they're trying to be biased. It's an inherent bias that a lot of times we have in our society, that when we look at a type of person, even though we don't have any hate in our heart, we don't want to treat them differently, sometimes we can't help it. And all of us have it. It's not being white because you have it, or being, from this side of the tracks because you have it. We all have some type of inherent bias. And the inherent bias a lot of times, with Black people interacting with the healthcare system, is that their pain and their complaints sometimes are not taken, with what they should be taken. We've looked at, women who have babies, and when they come in and say, hey, I'm having this pain, I'm having this cramping, a lot of times that's dismissed. That's like, oh, that's normal. It's okay. We're not going to give you the pain medications because you can endure it. And again, that kind of comes from that historical perspective where it was kind of expected for, Black people to kind of have a higher pain tolerance, not need to have, their pain managed. And so it still permeates through our society, today. And, we always tell people, when you need to advocate for yourself, that's a lot easier said than done. If it's just you and you're going up against, an army of kind of providers that are saying, no, you're okay, that's going to be hard to advocate for yourself. We always preach to try to have someone with you so that they can also help advocate for you. And it's just, really trying to say, hey, this is not right. It's a very difficult task, but, we can't let it go. We have to say, hey, this is the way it is. And this, if we're not being treated equitably, we have to speak up.
Absolutely. So we have inherited a survival mindset. Keep going. Don't complain. It's not that bad. And that mindset is costing us our health, especially in Black families that endurance is praised. Like, oh, you worked a 12-hour shift, or 10-hour days. So we're taught to push through pain, to avoid doctors unless something is broken, bleeding, or unbearable. And then also a mistrust, because historically medicine hasn't always protected us. So how do Black patients come in later? Why, or how often do you see Black patients coming in later than they should?
So, I mean, it's a very high percentage. It's hard to put an exact number on it, but it's definitely a high percentage. And again, it's because of this mentality that they can wait. If something is not hurting, or if something is not inhibiting me from going to work or doing what I have to do, it can be placed on the back burner. And, I deal, of course, with a lot of diabetes. And so, of course, that's prevalent in our society. And that's the one thing that you don't want to wait on, either being diagnosed with diabetes or having any complications from diabetes. The only way if you're having these complications or if something is going on is for you to talk to someone or to be educated about it. And again, this is when AI comes in handy, right? And so there's nothing wrong with going on the ChatGPT or whatever AI software that you want to use and say, what are the early signs of, diabetes? What are the early signs of, peripheral neuropathy, which is numbness in the foot? And if you see you are having some of those symptoms, that's the time to say, well, I got to go and get some care. I have to see someone about it. And the other thing, what is tough is that a lot of times when we try to see someone, when you try to get an appointment with a doctor, how hard is it? I mean, it's so hard sometimes, even if you're
Right.
trying to seek that care to get in.
Mhm.
You call somebody and the first thing they ask, what's your insurance? You know, you tell them insurance, oh, we don't take that insurance. Or, you know, when's the first time I can get an appointment? 6 months from now. You know, if you got to wait 6 months and you're starting to have these early symptoms, I come in 6 months, I'm already going to be having complications by then, you know? And so it can be very challenging to try to get into the system. And again, you know, this is why, you know, I try to build something a little bit outside of the system.
Right.
So people, it can be affordable and people can come in and get the information that they need. And so information is going to be power. If something doesn't feel right or something looks different, you know, you have to get it checked out. Even if it's not painful, you still have to get it checked out.
Absolutely. And that goes right into, if someone is listening right now, what are the signs they should never ignore, even if there is no pain?
Sure. So I'm going to put this in the context again of, because it's the two biggest things, neuropathy
Yes.
and we call it peripheral arterial disease or bad blood flow. So neuropathy generally is when you stop feeling, and usually it starts in your feet, but it can go up your legs, it can go into your hands. And so if someone starts to kind of get tingling in their feet and it usually starts in the toes, that's something you shouldn't ignore. Now, if you just banged your foot or something, you start getting some tingling, okay, that's all right. But if you haven't had any trauma and you just all of a sudden start getting tingling and it's starting to become consistent, that's something that you should not ignore. It could be a sign that you may start to have diabetes. It could be a sign that you may have some significant back problems or something like that. But it's something that you should tell your doctor about, whether it's your primary care doctor or you go to a specialist or a podiatrist or anyone and say, I'm starting to get these tingling sensations. Or let's say you start to, you know, having more dry skin. You never had significant dry skin before in your life. And then all of a sudden you're finding yourself putting on all this crazy lotion. The lotion doesn't work. You know, you're being ashy for no reason. And it's like, why am I so ashy now? That could be a sign that your nerves aren't working and they're not, you know, signaling your skin to make, you know, the serum to help your skin be more, you know, lubricated. And so that's another sign of your nerves not working. Now let's go on the blood flow issue. One of the earliest signs could be, you know, we kind of talked about it before. You look on your toes and you have this little hair on your toes. If all of a sudden you notice there's no more hair there, that could be a sign that there's not enough blood flow going down to your toes and to your feet. Or if when you start walking, you start getting like these crazy cramps in your calf. They don't hurt, but it's just something different. It's like, man, now every time I start walking, I kind of get this cramp in my calf. That could be a sign of lack of blood flow to your legs. We call it claudication, where you start to walking and you start getting these cramps in your legs. And so those are kind of some early signs that you could either have some nerve problems or some blood flow issues and you need to speak with someone.
Absolutely. So numbness or tingling, you said skin discoloration,
Mm-hmm.
swelling, is it
Swelling could be it. Yep,
okay? Slow healing wounds,
for sure.
cold feet or temperature changes, and thick or brittle nails. So I have a question for you because it's been cold here lately, and
Mm-hmm.
lately I can feel like my toes, like I can feel them getting numb. Is that because I'm cold, or is that a sign that I might be like going through some like diabetic changes or whatever the case may be?
Sure. For the most part, especially, you know, when we look at kind of age distribution, you know, if you're a little bit, below 50, 40s, that's probably like the temperature. You know, it's probably been cold and that's what's going on.
Yes.
If after things warm up, like we're going to go through a warm up this week and over the next couple of weeks, and your toes still feel like that, they feel ice cold, you know, they kind of, one thing I always tell people, you know, push it and, you know, the white should, you know, go away and the red should come back. If that takes more than like 4 or 5 seconds for that to happen in your toes, then, you know, there could be an issue with your blood flow. But like people over 50, 60, and they start to have those changes, their toes are cold all the time. I get a lot of people with that. And, you know, the first thing I do is we run some vascular tests, and they're very simple tests, nothing that hurts, but it gives us a lot of valuable information if they are starting to have some decreased blood flow in their lower extremities.
Okay, because you know with the chat, because I'm like, it's been cold, and I'm thinking, okay, that's the reason why, because this isn't happening until we've been outside or these extreme where I have to go to my car. I don't have a push to start. I mean, I have push to start, but I don't have the like you can freeze
Remote.
on your car. So I'm
Yeah.
in my car freezing, but then that's when I feel it. Okay.
Yeah, more than likely that has to do with the temperature. Yeah.
Yeah. Okay. 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 Good. So our favorite segment, trap or truth. Let's break some myths. So you kind of already touched on this, but let's kind of reiterate it. If your feet don't hurt, there's nothing wrong.
We
Trap.
all know that's a trap. And
Yeah.
so, I don't want to fear monger people and scare people, but at the same time, I want them to be aware of things that go on with their body. Again, the biggest thing is, if you have diabetes and you start to feel numb in your feet, or you start to have swelling, or you start, like you were saying, to have, a sore or a scratch that doesn't seem to heal up like it used to. Those are subtle warning signs that you may have maybe uncontrolled diabetes, and you need to get to the doctor to get on some medications or whatever the case may be, because if you catch it early, you won't be in the hospital undergoing all these surgeries, and we call them INDs or amputations and things of that nature, and dealing with these wounds. If you catch things early and say, hey, this scratch that I did, usually I heal up in a week, it's been 3 weeks, and it's not getting any better, and then we can catch things and we can get you on the right track. So even if you're not having pain, and you notice these things, let someone know.
Absolutely. Okay. Trap or truth. Foot problems are just a part of getting older.
Very much trap. I hear all these people come in, and I shouldn't say it bothers me, because I'm glad people are seeing me. But when people come in and I say, hey, how long have you been dealing with this? 6 months. Like 6 months. Why have you been dealing with this pain or this issue for 6 months? And then most people are, like all of us, well, I've been busy, or I thought it would go away. But, after like a month and you're still dealing with a certain issue, you gotta get some help about it. Foot pain is not normal. Now, short-term foot pain, if you are somebody who works in a factory 12 hours a day in steel-toe work boots, and then when you get off, your feet are sore, definitely normal. But that soreness should get better as you recover and rest there. Now, again, I always tell my people, like my factory workers, a lot of these folks, like you said, they're grinding. A lot of people come in, they're working 6 days a week, 12 hours a day. And I'm like, I can't compete with that. There's not a lot of things I can give you that's going to make you feel better, and you're working that much. But there's still certain things we can do. We can do inserts. I can give you, recommendations on certain shoes that you should be wearing, things of that nature. So you should still come in if it's been, I always tell people more than like 2 to 3 weeks. And if it's not getting better, it's one thing if things that are troubling, for like 2 weeks, but it's getting better. That's okay. But if it's 2 weeks and it's not better or getting worse, you got to see somebody. Foot pain for that long is not normal.
Okay, it's not normal, and it has nothing to do with age.
No. And with a caveat, there are things, arthritis. But still, arthritis is a pathology. It's something that can be treated. And so it's not normal. You should come in, get an x-ray. Oh, you have this going on in your x-ray. This is what we can do. This is the medication, the injection, the cream that we can put you on to help with your symptoms. So get checked out.
Indeed. One last trap or truth. Pedicures are just cosmetic.
No. So pedicures are needed for proper grooming. And I always tell people, people sometimes come to me and let's say they need a nail trim or something. And, they're like, oh my God, I can't believe I have to come in and do this. But like, they're like maybe 70, they had back surgery, they had different things going on. And it's like, no, you need to come to someone to do this. I mean, there's no way you can bend over and cut your nails properly and do the things you need to do at the position that you're in. So pedicures, they're not just cosmetic, they can be therapeutic, and it's just someone else looking at your feet. Sometimes it's hard to bend over and look at your feet. Even when I tell people to put their feet up in the mirror, sometimes they can't lift their feet up to do that. So having another person to come in to say, hey, that doesn't look right. You may want to go and see a foot doctor about that. Or, I'm going to trim your nails. These were getting ingrown. I caught them, I'm trimming them back right. This is going to save you an infection. So, pedicures can definitely be therapeutic for sure.
Absolutely. That is a trap. It is not cosmetic. I mean, yes, there is that spa
Yeah.
version of it, but it definitely is about health and wellness and hygiene and grooming. So, yeah, Dr. Lanier, you made it through that segment.
Made it through.
Indeed. So,
Bankhead bounce.
indeed.
I haven't said that in a long time.
No. So for generations, our ancestors didn't have the option to rest, heal, or seek care, but we do. And I feel like that's our reparations to be able to take personal time off, to take a vacation, to rest. That is our form of reparations. That's what I feel like. That is how we can reclaim and get some of that back for our, rest for your ancestors. But what does prevention actually look like?
So prevention is one, you should not just be going to the doctor because something is wrong.
Right.
You know, you should not be engaging in healthcare, but should be engaging in wellness. Wellness is the prevention of disease, is what you want to be doing. And so just because you're going to the doctor doesn't mean it's an acute visit. You know, I see a lot of patients, especially via telehealth, that are just seeing me so that they don't have to undergo, any surgeries or anything that's invasive. They say, hey, Dr. Lanier, this is what I'm going through. Or they could be a runner and they could say, hey, this is what I feel when I'm running. How can I, stop this? They may not be hurting a lot, but they just kind of feel something a little bit. And that's what we need to do and make normal is prevention so that we don't get to the point where we're talking about, hey, well, I gotta, cut your foot open and do this and put a screw in here and do this. We should always be thinking about prevention. That's the first and foremost thing, that should be going through our mind.
Absolutely. And what habits can help people avoid amputations?
Checking your feet daily is a big thing. Moisturizing your feet is the big thing. I see so many people that don't moisturize and they end up with dry skin, fissures, cracks, and that's a portal of entry for germs. That's how they're going to break that skin barrier and get into the deeper layers of your skin and inside your body and cause an infection. So looking at your feet every day, moisturizing all the time, keeping your feet, like after you get out of the shower, drying them off really well, in between your toes, like stuff that seems like so rudimentary and easy, but it's easy, but you got to do it.
Got
And
it.
it sounds like everyone will do it, but you don't. And you need to make sure you're drying off in between those toes because if you don't, that moisture stays in there. You end up with a fungal infection. That fungal infection creates a portal of injury. Bacteria get in, germs, and then again, you're in a bad place. And so, you just got to make sure you're always doing the same thing. Come up with a regimen. How you're going to clean between your toes, how you're going to look, on your feet when you wake up, before you go to bed, when you're going to moisturize. It's all about having systems in place and making sure you follow those systems.
Yes, I always hear this quote from, I listen to like Neville Garter in the mornings, but it's like, it's so simple to do it, but it's also so simple not to do it. And some people overlook the simple things because they think the harder things are, going to be the way. But it really is the daily small things
Mm-hmm.
that are really like transitioning our
For sure.
lives. hmm So, you said daily foot checks, routine professional care. We always talk about proper footwear, annual foot exams. What goes into an annual foot exam?
Respiratory, that's probably a good topic.
Well, then
Yeah, so
hold that thought then.
yeah, so I mean, but basically, you come in and there's various X-rays, various tests that we do that test every system, your blood flow, your nerves, your muscles, and all that good stuff, and to make sure everything is working. But yeah, we should go into that. I think that'd be a good one. I like it.
Foot exams. And that's pretty much all we have. So Black history isn't just about survival anymore. It's about longevity. Our ancestors walked so we could run, but now it's our responsibility to protect our feet that carry us along that journey. So mobility is freedom, freedom is health, and health is legacy. So one last question.
Mm-hmm.
What does foot health mean for aging well in our community?
So you want to make sure your feet are strong and healthy because think about it. If you can't move around, if you don't have the ability to exercise, and just move your body from point A to point B, think about everything else that's going to go wrong with your body. Think about your heart, your lungs, your muscles, upper and lower, if you don't have a firm foundation and keep your feet healthy. So keeping your feet healthy is keeping your body healthy. Foot health is total body health. And you need to start from the foundation. And if you start there and keep that healthy, it's a lot easier to keep the rest of your body healthy.
Absolutely. So this Black History Month, let's stop normalizing pain. Let's stop waiting until it's too late and protect Black health is also honoring Black history. And that, my ladies and gentlemen, is another 10 Toes Down episode. And continue to stay intentional.
Intentional, yep. So this is Dr. Lanier of Smart Set Foot and Ankle. Remember, follow us on socials, Smart Set Foot and Ankle. You know, we do good tips and everything like that. We'd be love to see you and hear from you. DM us. Remember to like, share, comment on 10 Toes Down.
Absolutely. And there you have it. You all have a great evening and happy Black History Month.
For sure. See you guys later.